Please.
Thank you, Chairperson, sir. Sir, first I wish to thank and appreciate the services of all the frontline workers, which include medical doctors, nurses, healthcare staff, sanitation workers, and volunteers in managing this pandemic. And I pay tribute to those who lost their lives, sir. Sir, I would like to thank our Honorable Prime Minister, Sri Narendra Modi ji, for having sanctioned 1,222 PSA oxygen plant across 736 districts of our country with a plant capacity of 9,47,400 LPM from the PM CARES Fund. I am most grateful that my constituency of Theni has also been sanctioned with 4 PSA oxygen plants from the PM CARES Fund, which have been commissioned already, sir. And also I thank our Honorable Minister for Health and Family Welfare, who has allocated a sum of 23,123 crores as a stimulus package through the ECRP2, that is Emergency Response and Health System Preparedness Package, immediately upon assuming office in July 2021, sir. Sir, this crucial package has significantly helped our states in gearing up for meeting the challenges of any abrupt outbreak of a third wave. Sir, I would like to share at this point few observations and suggestions before I conclude my speech. Sir, the second wave have witnessed a large spurt of in case due to over usage of steroid and medications. Hence, a focused and specific treatment protocol that one size fits all approach may be adopted to avoid secondary infection. Number 2, with regard to the reported cases of hoarding, black marketing of health appliance, oxygen, and hospital beds, etc., the government, both center and states, should take adequate enforcement measures to prevent such incidents, sir. Our previous experience have indicated that a more centralized planning, coordination, digitalized allocations of meager resources and decentralized execution at the state level is a need of an hour, sir. Hence, it is my humble request that more profound central intervention with regard to the allocations of resources, as well as centralized strategic planning and coordination will be more effective in the control of the pandemic than the state level approach. Number 4, sir, it needs to be understood that pandemic management, besides medical care, requires sound logistic management and information management, and hence we should explore the option to include the advisory of the defense and paramilitary forces more profoundly to coordinate the activities at the state level. And finally, there is only one effective strategy for controlling the long-term spread of the virus, that is vaccination. Sir, this is more critical considering the fact that the impact of more infectious variants like Delta can be reduced only by bringing a larger proportion of our population under vaccination. Further, considering the emergence of new variants like Omicron, we may further explore option to administer a third dose or a booster dose and simultaneously achieve the universal vaccination goal at the earliest. Sir, our country is in bounding stage. Now the latest news, 2 passengers who came from South Africa to Bangalore are confirmed Omicron positive. So the government should not take it easy. 2 persons can spread 200, 2,000 and more. Okay. WHO announced that this Omicron virus or not a modified version of Delta. We cannot judge it, but it is more dangerous than Delta. So my humble request to the government and Honorable Health Minister to take stringent action to prevent Omicron to spread in India at the initial stage itself and save the peoples of India. Thank you, sir.